Health Cabinet Secretary Mutahi Kagwe has warned striking health workers that they risk losing their jobs if they don't resume work. Kagwe asked the health workers to comply with a court order directing them to resume work in order to give dialogue a chance. However, the nurses and clinical officers unions say the order only applies to health workers under the Ministry of Health and has no impact on the ongoing strike that entered its 12th day today. Dr. Swangira reports.
As the nurses and clinical officers strike entered day 12 Friday, there is still no deal. Against this backdrop in Bungoma County, operations at the Bungoma County Referral Hospital, the COVID-19 Isolation Center in Webuye, and other public health facilities across the county's 9 constituencies have begun resuming, albeit at a slow pace. This was one of the public health facilities that was shut down without the essential and critical services of the nurses and clinical officers.
We encourage that if we can find a quick solution, a quick fix to the impasse, will save a lot of lives.
In Isiolo, the county government is accusing the health officials and clinical officers of going on strike just to show solidarity with other colleagues, even without substantial grievances.
I really want to appeal to the health workers in Isiolo, please report back on duty, respect the court rulings, and we will be able to see how we can take forward the challenges that have been raised.
In Murang'a, Health Cabinet Secretary Mutahi Kagwe has weighed in on the prolonged strike.
Therefore, I urge you again and appeal to you to adhere to the courts, what the courts have held, and to adhere to your own hearts to come back so that we can help our people. Having said so, I think it is also important for me to be clear. Those of you who may have been on strike to resume to avoid losing your jobs. Please do not lose your job.
However, the nurses and clinical officers unions have faulted the Health Cabinet Secretary for referring to a court order for a strike which commenced on 29th October this year by Ministry of Health staff, and not the national strike which commenced on Monday, December 7th, and maintain that their strike is legal and protected.
Mutahi Kagwe should be telling Kenyans what he's doing to pay them, rather than threatening them. Mgomo ule ambaye umepewa haya maagizo ni ule ambaye ulianza tarehe 29 mwezi wa 10 na unahusiana tu na wahudumu wa afya wanaofanya kazi na kitengo kile cha Ministry of Health. Wale wanafanya kazi katika ile hospitali ya Mathare, katika airport, na pia wale wanafanya katika spinal injury hospital. Mpira uko kwao, wapende kucheza, walale nao, wafanye nini, sisi mgomo utaendelea.
In this document seen by Citizen TV, the strike notice taken to the Labour Relations Court is attached to the certificate of claim dated 24th November and is different from the one that called for the national strike. The Cabinet Secretary, Ministry of Health is the claimant, and 6 healthcare workers unions as the respondents. Another document from the Kenya Health Professionals Society expressly says that the joint strike notice is over delayed promotions and redesignations.
I urge that each person resume their duties, continue to help wananchi, even as we speak.
The Nurses Union maintains that their members in public health facilities will not go back to work until their demands are met.
The government of the CS in any ministry cannot purport to be calling off any strike that they never called on.
For the 12 days that nurses and clinical officers in public health facilities have been on strike, the damage and the devastation is unquantifiable and irreversible. And with doctors set to join the strike on Monday, the situation is bound to get worse. Dr. Swangira, Citizen TV, Nairobi.